Welcome to Psych Prep Quiz, where we help you master the psychology with DSM-5-TR-based case studies and exam questions. You'll have 10 seconds to answer each question, so read carefully, choose the best answer, and let's begin. A 22-year-old college student develops hallucinations, delusions, and disorganized speech that last 5 weeks, followed by full recovery. No mood symptoms are present. Which diagnosis is most appropriate? C. Schizophreniform disorder. A 30-year-old has chronic delusions for 3 years, but maintains normal functioning and shows no hallucinations or disorganized behavior. Which diagnosis best fits? B. Delusional disorder. A patient presents with hallucinations and delusions for 4 months, along with a major depressive episode that overlaps fully with psychotic symptoms. Psychotic symptoms do not occur alone. What is the most appropriate diagnosis? C. Major depressive disorder with psychotic features. A 40-year-old patient shows waxy flexibility, mutism, and posturing following a severe psychotic episode. Which specifier or diagnosis is most appropriate? C. Catatonia associated with another mental disorder. A patient develops hallucinations shortly after starting high-dose corticosteroids. Symptoms resolve once the medication is discontinued. Which diagnosis best fits? C. Substance/medication-induced psychotic disorder. A 27-year-old has persistent psychotic symptoms for 8 months, with no mood episodes and marked social and occupational decline. Which diagnosis is most appropriate? B. Schizophrenia. A 33-year-old patient has psychotic symptoms and manic episodes. Psychotic symptoms persist for several weeks without mood symptoms. Which diagnosis is most appropriate? C. Schizoaffective disorder, bipolar type. A 19-year-old experiences sudden onset of hallucinations and disorganized behavior after a traumatic breakup. Symptoms resolve completely within 2 weeks. Which diagnosis best fits? B. Brief psychotic disorder. A patient with a brain tumor develops hallucinations and delusions that parallel neurological deterioration. Which diagnosis is most appropriate? D. Psychotic disorder due to another medical condition. A patient has odd beliefs, magical thinking, social anxiety, and eccentric behavior, but no sustained psychosis. Which diagnosis best fits? B. Schizotypal personality disorder. 26-year-old develops hallucinations and delusions lasting 3 weeks following extreme stress. Functioning fully returns afterward. No substance use is reported. Which diagnosis is most appropriate? A. Brief psychotic disorder. A patient has persistent persecutory delusions for over 2 years and occasionally hears voices related to the delusion but shows otherwise intact functioning. Which diagnosis best fits? C. Delusional disorder. A 29-year-old presents with hallucinations and delusions for 5 months, followed by complete remission. There is no functional decline. Which diagnosis is most appropriate? B. Schizophreniform disorder. Hey, quick pause. If you're studying psychology, social work, or counseling, this channel is for you. We break down DSM-5 topics, multiple choice questions, and case studies to help you pass exams and actually understand psych. Hit subscribe so you don't miss new quizzes every update. Now, let's get back to the question. A patient with long-standing schizophrenia becomes rigid, mute, and maintains unusual postures for hours. Which is the most appropriate clinical description? C. Catatonia associated with schizophrenia. A patient experiences psychotic symptoms only during manic episodes and never outside mood episodes. Which diagnosis best fits? C. Bipolar I disorder with psychotic features. A 21-year-old develops hallucinations after heavy methamphetamine use. Symptoms persist for several days but resolve after abstinence. Which diagnosis is most appropriate? D. Substance/medication-induced psychotic disorder. A patient shows social withdrawal, flat affect, and lack of motivation for several years with no delusions or hallucinations. Which diagnosis is most appropriate? B. Schizoid personality disorder. A patient meets criteria for schizophrenia but also has prominent depressive episodes that occupy the majority of the illness duration. Which diagnosis is most appropriate? C. Schizoaffective disorder, depressive type. A 23-year-old has magical thinking, odd speech, suspiciousness, and severe social anxiety but no hallucinations or delusions. Which diagnosis best fits? D. Schizotypal personality disorder. A patient presents with psychotic symptoms, but evaluation shows they are better explained by delirium due to infection. Which diagnosis should be made? D. No psychotic disorder diagnosis. A 20-year-old shows increasing social withdrawal, flat affect, and odd beliefs for 2 years. Recently, they developed auditory hallucinations lasting 3 weeks. Which diagnosis is most appropriate at this time? B. Schizophreniform disorder. A patient has a fixed belief that their spouse is unfaithful despite clear evidence otherwise. Functioning is otherwise intact, and no hallucinations are present. Which diagnosis best fits? C. Delusional disorder, jealous type. A patient with long-term schizophrenia develops sudden confusion, fluctuating attention, and hallucinations after surgery. What is the most appropriate diagnosis for the current episode? D. Delirium due to another medical condition. A 28-year-old reports hearing voices only when using cocaine. After stopping use, symptoms resolve completely. Which diagnosis is most appropriate? B. Substance/medication-induced psychotic disorder. A patient has persistent negative symptoms, avolition, alogia, flat affect, for several years following earlier psychotic episodes. No mood symptoms are present. Which diagnosis best explains this presentation? C. Schizophrenia with prominent negative symptoms. That's the end of today's quiz. Count your score, let us know in the comments how you did, and we'll see you in the next update. Bye for now, preppers.